Hello, everyone, and welcome to this webinar. Today is the 8th of September, which is World Physiotherapy Day. So we decided to host a webinar on how to advance your career in pain physiotherapy with the EDPP. And I'm joined here by two panelists, Harriet Whitting and Vanessa Peacock. I will let them introduce themselves in a second, but first, as we like to say, just a few housekeeping rules. So this is a webinar to let you know a bit more about the EDPP, the background, how it works, and how you can benefit from it. And then there's also some time for you to ask any questions. Feel free to ask anything you would want to know. This is your opportunity to find out directly from an exam director and also from a previous diplomat. Find out more about the EDPP, the whole process and how it works. Just drop your questions in the chat or in the Q&A module, and then we'll get to it. Yes, this webinar is also going to be recorded. So of course, it'll be added to our website, and then you can come back and review it again and again. But for now, I'd like to give over to Harriet. Welcome, and please introduce yourself.
Hello, everybody. My name is Harriet Whitting. I am the EDPP exam director, and I'll be talking you through the exam. And I'm joined here by Vanessa. Vanessa, you want to introduce yourself?
Yeah, absolutely. So welcome, everybody. So my name is Vanessa Peacock. I'm a physiotherapist, originally educated in Canada, and I am the winner of the Lourdes Gifford Prize for the 2022 EDPP. And I'm here to just talk about my experiences with it and hopefully answer any questions that you have about that part of it.
Winning the prize, I'll just say this year, means that Vanessa achieved the highest marks during that year. So she is an excellent candidate to let you know all about the exam. Yeah. All right, well, over to you, Harriet. Tell us a little bit more.
About the exam, at some point in the not too distant past, we decided we needed a curriculum for Europe, basically because the evidence says that the pain education varies enormously by country, and we wanted to harmonize the understanding of pain across Europe. So we made this curriculum, and we developed standards what we thought a pain specialist in physiotherapy should meet. And the exam was fitted to these standards. So that's basically what we're trying to do, to provide a qualification for physiotherapists to test the understanding of pain and pain management, but also to achieve a standard across Europe. Next slide, Belinda. So the structure is that we have three parts really. That's done in 2 sessions. The first session is the MCQ, which is 50 multiple choice questions that you get to do in 2.5 hours. It's in English, but we try to keep the language simple. The second part is the part 2 and 3, which is a clinical exam of a regular musculoskeletal pain patient. And we discuss 2 of the 3 cases that you hand in the Viva. So the Viva is basically a discussion between you and us about the people you've seen. Now, all the exams are done with 2 examiners, and the practical skills and the Viva are done by 4 people in total to make sure that you have no bias from any of the examiners. So there is no minimum for completing the multiple choice questions. We average all the parts of the exams to an average, and if you pass with a 65% mark. So if you do really badly on your pain knowledge, you can still make up for it by doing excellent on your clinical case and Vivas, which most people do. Right, next. So who can sit? You have to have an experience with people who have pain for about 3 years. You need to be a physio. I understand there are related professions like chiropractors, osteopaths, and such. They cannot sit. It's a physio exam. So you need to be a physiotherapist, and you need to be able to prove that you're a physiotherapist. you need at least one letter of somebody who can vouch for your standing of good conduct, a letter of endorsement, and that's basically it. So next, to prepare for the exam, we have a reading list. You can also go to the EFIC Academy education platform, which has a whole host of, say, YouTube films of lectures that have been done in the past in conferences to upgrade you on the knowledge of in the field. There are specific pain physiotherapy sessions, but you can also follow the psych sessions or the medicine sessions. There is a multiple choice practice exam, and you can look at some clinical case sessions. So there's a lot of information around that you can use to practice. And I guess that is all I have to say for now. Next, Melinda, we had a career impact. So a lot of people say, why should I sit for the exam? That's a good question. It's not going to earn you any more money, but it's going to prove to the world that you have expertise in treating pain patients, or patients with pain. So you enhance your professional recognition. We see, for instance, in the Netherlands, that a lot of faculty members are doing the exam to improve their standing amongst their colleagues and show that they really understand pain science and pain management. It helps you as a private practitioner to show that you have the expertise, and it also recognizes standard of care across Europe. So previous candidates, people who have passed, are saying that they've gained a lot from doing the exam. But I think the best thing we can do right now is ask Vanessa why she sat the exam and go over to her. Vanessa, tell us why you decided to sit for the exam.
So I decided to sit for it because I had also been a member of EFIC previously, because even in Canada there are like postgraduate diplomas in pain physiotherapy, but the EFIC diploma was a lot more comprehensive, and it was also the most flexible because I'm a full-time physiotherapist, and I really appreciated the fact that I was able to study using the online materials and just sort of fit that into my schedule a little bit more easily than actually taking a set curriculum, which is sort of all that was available in Canada. And I also have applied for recognition in Ireland and wanted to make the transatlantic cross over. I previously worked for 6 years altogether in chronic pain in injured workers, but I also didn't have any credential to support that. And one other nice thing was actually just to be tested and actually see, okay, are we has what I've been doing actually been as evidence-based as I hoped it was, basically is what I have learned actually on level with a world standard for pain physiotherapy. And I like I said, I previously signed up because I was interested in practicing in Europe, and I'd attended a couple of the online conferences and found them fantastic. Just absolutely love them. And so that's why I signed up for it, to make a short story long.
So it basically gave you the flexibility to study in your own time. Is that what you liked about it?
Yeah, absolutely. Because I mean, I work 40 hours a week. So going to classes in person or even a lot of other resources that were available in North America were timed, structured, and I simply couldn't fit them into my workday. So that was the absolute best part. And you have like a flexible amount of time to study for the exam as well. I think I ended up taking about 8 months altogether, and went through the entire curriculum, used the materials that I'd seen presented in the conferences as sort of a basis for this is the level of detail that could be expected, and just made sure that I could essentially answer all of the points that are on the pain curriculum in terms of like this is what's going to be covered, and if you can answer this question, you'll probably do okay.
Thank you. So you studied by going to the EFIC platform,
Yeah, absolutely. Yeah.
going through the reading list, and then holding on to the curriculum itself.
Yeah, and just going through the list of items that essentially this is what could be asked, this is what could be covered, and then just simply asking myself and then reviewing items from the reading list of can I answer this question? That was, and then I made flashcards based on those points in the curriculum.
All right, and could you say how many hours you studied a week?
A week, it was probably about between 5 and 10 altogether. Yeah.
All right, so that's still quite a heavy study load.
Yeah, but it wasn't. But it was very because I had made the flashcards. I would recommend anybody to do this. I was able to do it like while I was, in the bus, while I was in the train, while I was going somewhere, because that's just how I've studied. I found the materials, made questions, and then just referred to those questions and did those slides while on the way to doing anything. So, I mean, 5 to 10 is sort of my guesstimate when I just think about how many hours I was on a train, on a bus, like going somewhere, and then was also just using the app and using the flashcards to review. I don't actually think that you need to spend that much time studying, and I definitely went through phases of, okay, I'm going to intensely study for a month, get all my flashcards made, and then I'm just going to casually go through them. And then, of course, about a month before the exam, then I went and more intensively studied everything again. But I took breaks. It was not a slog like that. That I can actually absolutely say is that studying for it was not painful. It did not involve sacrificing life, limb, family, or hobbies or anything. I was actually able to integrate it into my work and personal life relatively easily.
Okay, that's good to hear. And then when you sat the exam, what did you think? What did you think of the multiple choice questions? Were they terribly difficult? Because most
They
people,
They weren't. Yeah. I thought they were very fair. And there were definitely ones that were challenging, where I was either unaware of what the correct answer was or I was uncertain what the correct multiple choice answer was because I saw, oh, that one could be right, but perhaps the other one. But I definitely didn't find it inappropriately hard. It was definitely doable when you've reviewed the what's expected based on the curriculum points. I didn't find it to be anything that there weren't any total curveballs out of left field that one had like absolutely no idea where they were coming from.
all right, did you think that the pain science was very hard?
Pain science was very fair. To be fair, I think I was in a happy position in a way because where I was working with workers with who had complex pain post injury. I had also started a pain neurophysiology education program for those workers that we implemented in the course of their program, and so I was teaching that to the patients on a weekly basis. And so I had that relatively well under control. I think when I went back to review materials in preparation for the exam, that was the stuff that I actually reviewed the least. I tended to review more,
Okay.
so conditions that I wasn't completely familiar with, that I hadn't, had a lot of practice in handling, like complex pelvic pain, for example. That was something that I actually didn't have much experience in, so I reviewed more questions about that, and more questions about like cancer pain and cancer physiotherapy. But yeah, I think there I was a little bit lucky just because my work had sort of already familiarized me with the pain neurophysiology. But I found the questions on pain neurophysiology were not so specific that they came again completely out of left field. They were general enough specific enough that they showed that you had expertise, but they were also not so specific that you had to be a researcher in order to understand them.
All right, thank you. Because many people are a bit afraid of the pain science because it's not necessarily something they got in their education at all. But as you clearly said, it's important also in the treatment of your patients, right? To understand the material well.
Well, yeah, because the patients have to understand the material. So you have to understand it so that you can explain it. I mean, that's always what Noy Group, emphasizes is it's like an iceberg. There's what you have to know, and then what the patients have to know is a relatively small amount. But in order for them to know it, you have to know it well enough to explain it in a way that makes sense and that is accurate. So you do require that amount of knowledge, but it's not impossible to know. It's not so much that you cannot learn it and that you cannot learn it well enough that you can summarize it for somebody else.
Thank you. And then the second part, the case and the Viva. What did you think?
The Viva was a lot of fun, actually. I got to reconnect with a couple of old patients who then became my Viva examples and got their consent for that first. And the Viva I had the most passion about because I knew the patients that I treated and knew a lot about the interpersonal factors, this psychosocial factors that influence their pain and I found the case study, it was really good to go over that case study again and to really like refresh that knowledge about this specific person and how the big picture of the biopsychosocial model of pain actually applies to a specific individual. And I found that the questions about the Viva were also extremely fair, and it was really easy to talk to the examiners about the candidate and explain these factors. Like I found the Viva actually was a lot of fun. I was very enthusiastic about the Viva, and it was also not difficult to write. You had to set aside a couple of whole evenings just to write it well. But I didn't have any trouble, and I also didn't have any trouble getting consent from a couple of patients to write it either. Former patients, they were quite happy to share their stories.
Oh, that's great. Thank you. Yeah, that's the feedback we get from more people that they really enjoy the Viva. And actually, we lengthened the period of time to talk about the Viva because people like it so much. It's kind of, a peer review on patients. It's lovely to do for examiners as well. So, and the case, how did you think that went?
I was very nervous. I think everybody is very nervous with the case.
Everybody's very nervous. That's true.
Everyone is extremely nervous. But I did not think I was going to win the highest score. But when I walked out, I was like, I think I passed. But I was very, very happy to find out later that I did better, even better than I thought. I was very nervous, but I went on some kind of an autopilot that ended up being meaningful. And I also do remember not being completely shocked by any of the skills that we were asked to present. They were all presentable. They were all things that we've learned in physio school, and so it was just a matter of getting over the nervousness and just realizing, like, oh, actually, you know this. You've done this. You've done this a million times. We've learned this. We've done this with patients. It was nothing unfair, and it was nothing out of again, out of left field. It's all very fair, and the examiners did a great job, like letting you first of all take a little bit of a moment to deep breathe and to calm yourself down and to let some of the tension come out of the room. You definitely didn't feel like you were sitting in a pressure cooker, being very, very, very cruelly scrutinized. It was a very like friendly atmosphere, and and you did have a chance to sort of take a sip of water and relax and just and then we had a little bit of time to think about how we're going to perform the skill as well. So I mean, even the timed component of the exam was not under extreme pressure. I've definitely been in exam situations where there was an extreme time pressure, and this exam was not that extreme. We definitely had enough time to correctly perform the skills.
All right, thank you. Yeah, we're nice people. We try to make you succeed at the job. Yeah,
You
thank
are you
you.
are nice people.
So I'm really curious to see if anybody has any questions. Um,
But also, if not, I actually have a few as well.
do you have a question?
Yes. So if people are maybe still thinking about it, or if you're just here to listen, that's totally fine. I absolutely understand. But because this is a great opportunity to find out more from Harriet and also from Vanessa, I was wondering, Vanessa, you did the exam in 2022, and I was just wondering if you could tell us a little bit more about what happened since then. Is how has it changed anything, or how has it changed in your daily practice? I don't know if you know how your career has developed since then. Maybe you can give us some insight on just anything you could share in that regard.
Yeah, absolutely. So one thing that really nicely, it definitely improved it because some of the people that I interviewed with mentioned it, was I started mentoring other physiotherapists in pain physiotherapy. So that was a new position that I took on in my current job. And I've also been doing locums, like kind of going back and forth from between Canada and I have had absolutely no trouble getting locums whatsoever. Before it was a little bit hit or miss, and then suddenly I just started getting pretty well everything that I applied for. And this was sort of one of the big reasons that I had it in mind to do this, for specifically with the aim of going into teaching in my career. And I have gotten a teaching position since then. So I'm a
Congratulations.
part-time lecturer, and that was really what I wanted to get into, and that was what I was thinking that the EDPP would help with, and it seems to have done that. Like I said, there's been a
Yeah.
couple of interviewers that have specifically mentioned. What I also find, and this is I mean, I don't know how relevant this is for everybody watching, specifically only from Europe. But as a Canadian physiotherapist who's qualified in Europe, it makes a difference in Canada as well because they really respect the European credential. They see the quality of it, and there's no sense at all that like, oh, what's that? It's more like, oh my goodness, you have a European pain physiotherapy diploma. Well,
Oh.
that's fantastic.
That's really fascinating because I
Yeah.
wanted to ask about that as well. What your response was to people seeing that you are an EDPP diplomat, whether it's from patients or from colleagues, or like you say, in interviews or in things that you apply for. So you have been getting some responses. People are, not everyone, but people are definitely asking you or recognizing that, you'd say.
Yeah, oh, definitely recognizing it. It is something that just sets one a little bit apart from the competition, definitely. And when they have a pile of resumes to look at and they see that you have, again, a recognition that is not typical for that region, but that is very, very high quality. And a couple have gone on the website and looked at exactly what's asked, and like, it's definitely a world contender.
And then one question I just had for people who are, because I assume that a lot of people who are watching this are thinking of doing it, or maybe they're on the fence. And do you have any advice for people who are considering or who are about to like start this journey of doing the EDPP? Do you have any advice on how they should approach that or anything at all that you could share?
Yeah. Well, Esma, I would just say definitely just do it. There's really nothing to be terrified of. It seems like a lot of material, but you definitely can get through it, and just study for it like you would study for any other test. Like I think the curriculum is quite good in that it lays out all of the points that if you think you halfway can answer them, then you will probably have enough knowledge to do well on the test, at the very least to pass. And then to use the reading list to build your knowledge, and like I'm a huge fan of flashcards. I'm a huge fan of take this point and then turn it into a question and then answer it and then go ahead and review those answers. And it was not as as like painful. I don't like that word, but it was not as difficult to study as I thought it may have been. I think most people probably assume that it's much more of a challenge and takes a lot more time and a lot more dedication than it does. It takes time, it takes dedication, but it's not an impossibly high level, especially like even for a full-time working professional with family, with everybody. But that was sort of my big one, and then absolutely the online conferences, or even the conference that happens every 2 years. So if you go to the conferences too, you have a much better idea of what's going to be presented, what sort of the level of knowledge is, and the knowledge that was presented at the last conference in Lyon as well was absolutely amazing. Like pretty well every uh conference, like every presentation that we
Session.
went to was fantastic. Like practically in all of them you took away a couple of points that improved your practice. And of course, if you don't do as well as you wanted to, you can always retake it. That's also the other thing. It's not even a one and done. And the price is very fair for the education and for the qualification. So That's sort of those are my little pieces of advice that
That's great. That's super helpful. Thanks, Vanessa. I also had one question to Harriet. As Harriet is our exam director and has been with the EDPP sort of from the start. Harriet, I wanted to know what you think about the future of the EDPP and how do you think the importance or the role of an EDPP qualification is that going to become, more important? How is that going to work into the world that we have now, within pain medicine, based on also what Vanessa said and how, kind of it sets you apart, but also just this wealth of knowledge that we have?
That is a big question, Melinda. I think it's going to be more and more important as we're really looking at an epidemic of people with chronic pain. I mean, as the population is getting older everywhere, we're going to see a lot more people who have pain, and we need qualified practitioners to treat these people well. And we have the knowledge and the skills to treat people well, I think now, but that's not true for everybody everywhere in Europe. And I think it's absolutely necessary that we aim to achieve a unified standard of pain management for everybody who has pain. And it is and we as physios are in an excellent position to do something about this. So, yes, I think it's hugely important, and I can't emphasize enough the importance of increasing your knowledge on this topic, because it's going to be the majority of the people you're going to see. So, in daily practice, these are the people who will come to you for help, and I hope you'll be able to do that well for their sake. Yeah.
Amazing. Thank you, Harriet. Well, seeing as we don't have any questions at the moment, I was wondering if Harriet, you or Vanessa, you have any final words that you would like to share before we draw this to close.
I just wanted to add on top of what Harriet said about this is the majority of patients that we see are people with complex pain. It's also so important to be correctly trained in pain management to prevent patients with acute pain from becoming complex. Because we know that one of the reasons that happens is contact with a healthcare practitioner that unfortunately creates anxiety in the patient about their pain, that without knowing, without intentionally, meaning to do that, that actually sets up some of these risk factors for the progression of acute pain into chronic pain. So, and all of us see patients because of pain. I mean, I think 2 patients that I've ever had that came in preventatively. Pretty well everybody else comes because they have a pain problem. So this is the bread and butter of physiotherapists. We see people because they're in pain, and we're in a really good position to help them if it's already tending towards complex, but even if it's acute, so that it doesn't become complex.
Thank you, Vanessa. That's a really important point to make. Yeah. So I think, yes, for the sake of our patients, we're really obliged to increase our knowledge about pain science, pain management, for all types of patients. And so I hope to see all of you at the exam. Will be nice, I promise. And if you have any questions, contact me or Melinda or anybody of the ethics staff, and we'll get back to you.
Absolutely. Yes. If you have any further questions, there's a web of information on our website, but you can always reach out to us and find out more. The next sitting for the next virtual sitting for part 1 of the EDPP is taking place on the 14th of November of this year. And 2026 will be the next in-person sitting for part 2 and part 3. And you can register until the 14th of October for this year's setting for part 1. And yes, any other questions, you just let us know. Harriet, Vanessa, I am so thankful for you to take the time to come in this webinar with me and answer some questions. Everyone, oh, sorry, one final question, super quick. Yes, Rika, of course, that's what we're here for. You waited like right until the last second. For the multiple choice part, is it only section one from the curriculum we need to know?
No, no. There's 4 sections to the curriculum, and they're equally divided over the multiple choice questions. So you need to know about all 4 sections. Does that answer your question?
Yes, it does. Amazing. Well, good for you for getting this question asked. As I just said, thanks so much. Any other questions, you just get in touch with us, and I wish you a wonderful rest of your week. Thank you all. Bye bye.
Thank you.
Bye-bye.
Bye bye.